how do you biopsy these lesions? Do you just remove them? Even if you were to want to remove them, how do you remove them? Because they are not felt to the hand, and the breast is a three-dimensional structure. Therefore, the next step in the diagnosis of breast cancer, especially of the small lesions or even in a small lump that is felt to the hand, is a needle biopsy. Now, this slide shows you various options of biopsies. One is, many people know, is what is known as a FNAC, that is a fine needle aspiration cytology. Then there is the true cut biopsy, and then there is a vacuum assisted biopsy, and finally there is an open biopsy. As is shown in the slide, an open biopsy is never to be done. That means no surgery for diagnosis. If there is a lump, go through a mammogram, an ultrasound and a needle biopsy. If it shows no cancer, the tumor or the lesion does not need to be removed from the breast. So 90% of women coming with lumps and symptoms or on those detected on mammography do not need any surgery. Needle biopsies, and especially the true cut biopsy, is the operation or the procedure of choice. It is done under local anesthesia. There is virtually no pain, and the needle is passed into the tumor under ultrasound guidance, as is shown in this slide, and it actually takes a small piece from the tumor for diagnosis. This small piece can be analyzed very accurately. This has a 98% accuracy and is the biopsy of choice or the gold standard of biopsy techniques all over the world. And FNAC, which is very commonly done today, is not anymore recommended as the choice of biopsy. This biopsy technique helps not only to diagnose that this is breast cancer accurately, but it can also give us a sample of tissue for further tests, so as to classify the tumor into those various types that I mentioned during an earlier module. Now imagine that the tumor is very, very small. The tumor is less than 5 millimeters in size. The tumor is not felt to the hand. The tumor is only seen on an ultrasound or a mammogram. How do we biopsy this? So we have a very special instrument in the clinic which is known as a vacuum assisted biopsy device. There are two varieties of them. One is the Encore and the other is the Mammotome. These biopsy devices help, as is shown in this slide, to target the tumor very, very accurately. This has a virtually 100% accuracy in biopsying a small lesion, especially which is less than 5 millimeters. The needle is passed under the tumor and the needle sucks the tumor into the needle, and there is a saw that cuts it out, as is shown in this slide. And the biopsy is extremely accurate. And this is again a gold standard of biopsying very small tumors less than 5 millimeters, or the microcalcifications that are sometimes seen, which are very tiny and may represent a precancerous lesion. So this is again a gold standard in the diagnosis of breast cancer. Again, the VAB or the vacuum assisted biopsy is done under local anesthesia. All these needle biopsy procedures are painless, scarless, there is no scar, and the patient walks in and out of the clinic within an hour of the biopsy. So it is a completely an office procedure. There is no admission and there is no pain and there is no scar.